Hello, and welcome back to Honest Healthcare. As our country undergoes dramatic shifts, our COVID committee and frontline healthcare heroes have been working tirelessly to implement the most up-to-date strategies for curbing the coronavirus. With no new cases across facilities, many previously infected patients recovering, 5 out of our 7 facilities now COVID-free, and in-person visitations returning, with strategic social distancing measures in place, it's beginning to feel like we've turned a corner on the road to recovery. However, while the national public health emergency has an end date of July 24th, we know our work is far from over. This week, we thought we'd share some of the specific strategies that have been effective, from weekly testing cycles, to resident cohorting, to virtual and now in-person social distancing visits. One of the key practices in getting control of this virus has been weekly testing cycles of all staff and residents. While resident testing has been done primarily in-house by our nurses and then sent off to labs to be processed, staff testing has been conducted in part by outside partners so as not to impede workflow. In some cases, this means that a company will set up a tent outside the facility where staff can go get a quick test at a designated time and return to work before the next test occurs. This continual cycle of staggered testing restarts as soon as the last person is tested. For the on-site resident testing, nurses administering the test wear isolation gowns and face shields on top of their standard protective equipment, while another staff member stands outside the room. The biggest challenge right now in regard to testing is that we can't be sure the status of incoming patients from hospitals matches up with what hospitals are telling us. This may in part be because tests used by the hospitals include fewer genes than our testing kits, and patients could have been exposed but not yet contracted the virus for the first 24 to 48 hours prior to their arrival. Unfortunately, whatever the cause, it's been a bit of a pattern, which is where resident cohorting comes in. As part of DPH guidelines, we've designated 3 separate units, or areas of each facility, to house 3 different categories of residents: COVID negative, COVID positive, and under observation. This allows us to isolate infected patients, monitor those potentially affected, and implement all necessary precautions while providing care for the whole facility. Because we can't be 100% sure about the status of incoming patients, they all spend a minimum of 14 days in the observation unit to ensure they don't start showing symptoms or get a different test result within the first couple days of their arrival. Of all the units, this one has the most complex set of rules for staff. They must wear full PPE, use new gowns with each resident, and designate a specific set of equipment for the unit, just to name a few. The one variable in this increasingly tight system is the state inspectors coming in every week. Since they're not tested prior to arrival, all we can really do is take their temperature at the door, conduct a CDC-recommended symptom-based COVID screening, and provide them with PPE. Still, we run a tight ship. Because the COVID committee oversees all facilities collectively rather than focusing on just one, they're able to spot practices that need improving, as well as effective strategies that should be replicated, like those of Douglas Manor and Bel-Air Manor, which have managed to remain COVID-free. Although we're currently reviewing and revising all our COVID-19 protocols to comply with reopening guidelines, each facility continues to uphold current virus containment practices such as hand washing, cough etiquette, social distancing, screening residents and staff every shift, universal mask wearing, and real-time communication with committee oversight. We continue to be diligent with infection control practices to promote safety and quality outcomes for residents and staff in each of our facilities. Now, as we turn the corner on the road to recovery, we've begun facilitating in-person visitations, in addition to the virtual FaceTime, Zoom, and phone visits. In-person visits occur outdoors with the standard social distancing measures of 6 feet between resident and visitor, masks, staff supervision, and a maximum of 2 residents at a time. If you have a loved one at a Ryders facility who is currently COVID negative, call ahead and schedule a 20-minute visit. We're sure they'd love to see you.